Obesity is considered a health hazard and is associated with a wide range of health problems and an increased risk of chronic diseases. Here are some potential health risks and hazards associated with obesity. 1. Cardiovascular diseases. Obesity increases the risk of heart disease, high blood pressure, stroke, and other cardiovascular conditions. 2. Type 2 diabetes. Obesity is a major risk factor for developing type 2 diabetes, a chronic condition characterized by high blood sugar levels. 3. Respiratory problems. Excess weight can lead to breathing difficulties, sleep apnea, and other respiratory disorders. 4. Joint problems. Obesity puts extra stress on the joints, leading to conditions like osteoarthritis and joint pain. 5. Metabolic syndrome. Obesity is often linked with metabolic syndrome, a cluster of conditions that include high blood pressure, high blood sugar, abnormal cholesterol levels, and increased abdominal fat. 6. Certain types of cancer. Obesity has been associated with an increased risk of various cancers, including breast, colorectal, kidney, and liver cancer. 7. Mental health issues. Obesity can contribute to mental health problems such as depression, low self-esteem, and body image dissatisfaction. 8. Digestive disorders. Obesity is linked to conditions like gallbladder disease, fatty liver disease, and gastroesophageal reflux disease, GERD. 9. Reduced life expectancy. Obesity is associated with a higher risk of premature death and decreased life expectancy. It's important to note that not everyone who is obese will experience all of these health problems, and the severity of the risks can vary. However, maintaining a healthy weight through a balanced diet, regular physical activity, and appropriate medical management can help reduce the health hazards associated with obesity and improve overall well-being. Obesity is a significant and widespread problem in the United States. According to CDC, obesity rates have been steadily increasing over the past few decades. Here are some key statistics regarding obesity in the USA. In the most recent data available, 2019-2020, the prevalence of obesity among adults in the United States was approximately 42.4%. This means that nearly half of all adults in the country are classified as obese. 2. Childhood obesity. Childhood obesity is also a concerning issue. In 2019-2020, the prevalence of obesity among children and adolescents aged 2 to 19 was approximately 19.3%. This translates to about 1 in 5 children and adolescents being classified as obese. 3. Health consequences. Obesity is associated with a range of health problems, including an increased risk of chronic conditions such as type 2 diabetes, heart disease, stroke, certain types of cancer, and respiratory disorders. It can also hurt mental health and overall quality of life. 4. Economic impact. Obesity places a significant economic burden on the healthcare system and society as a whole. The costs associated with obesity include medical expenses, productivity losses, and decreased quality of life. 5. Disparities. Certain population groups, including racial and ethnic minorities, low-income individuals, and those living in rural areas, tend to have higher rates of obesity. These disparities can be influenced by various factors, such as limited access to healthy foods, higher levels of food insecurity, and environmental factors.